Hello everyone, I'm Dr. Monica. Today in this video we'll discuss the various types of gingiva. So let's begin with the definition. According to Carranza, gingiva is that part of the masticatory mucosa which covers the alveolar bone and the tooth root to a level just coronal to the cemento-enamel junction. So we have three types of oral mucosa, that is a lining mucosa, masticatory mucosa and specialized mucosa. So gingiva is in the category of masticatory mucosa. Talking about the macroscopic features of gingiva, gingiva can be anatomically divided into three types, that is marginal gingiva, attached gingiva and interdental gingiva. Now let's look at the diagram to understand the different types of gingiva. Starting with the marginal gingiva, this type of gingiva, it is found at the neck of the tooth. It is not bound to the underlying bone and it forms pocket with the underlying gingival sulcus. Next we have is the interdental gingiva. This type of gingiva, it is found between the two adjacent teeth and it is triangular in shape and prevents food accumulation. Coming to the attached gingiva, this type of gingiva, it is firm and it is bound to the underlying alveolar bone and it helps in providing stability and protection to the overall gingival surface. Next comes the mucogingival line. So this mucogingival line, it is the boundary between the attached gingiva which is non-movable and alveolar mucosa which is more flexible. Next is the alveolar mucosa. It is darker movable tissue and it helps in the movement of lip and cheek. So let's discuss one by one different types of gingiva. Starting with the marginal gingiva, as we can look in the diagram, this forms the coronal border of the gingiva surrounding the tooth. It is non-adherent to the tooth surface, that is, it is free and it is also not bound to the underlying bone. It is about 1 mm in its width and it forms the soft tissue wall of gingival sulcus. As we can look in the diagram, there is free gingival groove, which is a shallow linear depression. This groove separates the free gingiva from the attached gingiva. And periodontal probe can be used to separate the marginal gingiva from the tooth surface. The most apical point of the marginal gingiva in the scallop is called as gingival zenith. Its apicocoronal and mesodistal dimensions, it can vary between 0.06 and 0.96 mm. Now let's talk about gingival sulcus. It is a shallow crevice or space around the tooth bounded by the surface of tooth on the one side and the epithelium lining the free margin of gingiva on the other side. As we can see in the diagram, it is V-shaped. Its depth has been reported to be 1.8 mm with variation from 0 to 6 mm. The clinical determination of the depth of the gingival sulcus is an important diagnostic parameter to classify whether the gingiva is healthy or not. For this, periodontal probe is used to determine the depth of gingival sulcus. The penetration of the probe, it depends on various factors, that is the diameter of the probe, the force with which the probe is inserted inside the gingival sulcus, and whether there is presence or absence of inflammation. The probing depth of the clinically normal gingival sulcus in human, it is reported to be around 2 to 3 mm, whereas histologic depth of the sulcus, it may or may not be equal to the depth of penetration of the probe. Next we have the attached gingiva. According to GPD 1972, attached gingiva is that portion of the gingiva that extends from the base of the gingival crevice to the mucogingival junction. In this diagram, we can see presence of stippling, that is small orange peel-like texture, and it is the characteristic of attached gingiva. Presence of stippling, it is a sign of healthy gingiva. Coming to the function of attached gingiva. Attached gingiva plays a crucial role in oral health. It helps in protection, that is, it resists external injury from brushing and chewing. Next is stability. Attached gingiva keeps the gingival margin in place against friction. Also, it dissipates physiological forces exerted by the muscular fibers of the alveolar mucosa on the gingival tissue. Attached gingiva also contributes to a well-contoured healthy smile, playing a key role in aesthetics. It also aids in plaque control, that is, a wider attached gingiva makes cleaning easier, reducing the buildup of plaque. It also helps in durability by withstanding strong chewing forces. Now, talking about the width of attached gingiva, it is the distance between the mucogingival junction and the projection on the external surface of the bottom of the gingival sulcus or the periodontal pocket. It is minimal in the newly erupted permanent teeth and it increases after its eruption. In the anterior region, the height increases from the primary to permanent dentition, more in the maxilla compared to mandible. The width of lingual attached gingiva decreases from the primary to permanent dentition. Let's look at the diagram to understand how to measure the width of attached gingiva. In this diagram, width of attached gingiva is represented by C, which is obtained by subtracting B from A. So A here represents the distance between gingival margin and mucogingival junction. From this, we subtract B, that is the distance between gingival margin and free gingival groove, to obtain the attached gingiva width. Width of attached gingiva, it is found to be greatest in the incisor region. In maxilla, it varies from 3.5 to 4.5 mm. In mandible, it varies from 3.3 to 3.9 mm. In the posterior segment, it is narrow with least width found in the premolar area. In maxilla, it is 1.9 mm and in mandible, it is 1.8 mm. In the mandible, the gingiva on the lingual aspect, it is narrower in the incisor region and wider in the molar region. Now let's talk about the mucogingival junction. It is a junction between the masticatory mucosa represented by the attached gingiva and the lining mucosa represented by the alveolar mucosa. It is located on the labial and the lingual gingival surfaces but absent on the palatal surface. Clinical relevance is that it is used to determine the width of keratinized gingiva, flap designs, gingival grafts, etc. Now let's talk about the last type of gingiva, that is the interdental gingiva. Interdental gingiva, it occupies the gingival embrasure, which is the interproximal space beneath the area of tooth contact. Interdental gingiva can be of two types, that is pyramidal shape and of cone shape. The pyramidal shape is in which the tip of one papilla is located immediately beneath the contact area. Now talking about the cone-shaped interdental gingiva, it is a valley-like depression that connects the facial papilla to lingual papilla and it conforms to the shape of the interproximal contact. The cone-shaped interdental gingiva, it depends on the contact area, cemento-enamel junction cores, and whether there is presence or absence of recession. In cases of diastema, gingiva it is firmly bound over the interdental bone and it forms a smooth rounded surface without interdental papilla. Please like and subscribe this channel. Thank you.